Hi there. My name is Oliver. I'll be your physiotherapist or physical therapist for today. Welcome to the Physio Zone, one subsidiary of OZONE Industries. You may have been to the OZONE Medical Centre previously. Yes, we get some referrals from there actually for some of our patients, but I understand you are here for some pain. What seems to be the problem or the issue at hand? Yeah, just a brief explanation's fine. Okay, that's good. I see, okay. Right, I hope you don't mind me writing this down. Our document for online documentation is currently offline, so just using paper notes for now. You know how it is. But I just wanted to confirm your name and date of birth before we continue any further. Yeah, just the full name, please. I see. Just the common spelling of that one? Perfect. And then just your date of birth for me, please. Oh, yeah. I've got a family member with the same birthday. Different year, but same birthday. Well, I see you've just explained a little bit about your problem today. So it sounds like some back pain is being an issue. Is that right? And how long has this been a problem for? Can you put a week or day figure on it? Okay, just document that one. Okay, and was there any specific activity or movement that you were doing to set this off? And we call this a mechanism of injury. Yeah, a mechanism of injury. Can you think of anything that may have caused this? I see. Very well. In fact, I'll just write that one down so I have a reference for next time. Okay. And you felt instant pain as you were doing this, or was it more so something that got sorer over time? Pardon me. Potentially even the next day. How would you describe the onset of symptoms? Okay. Right, I understand. And in terms of your level of pain at this very moment, now, pain is very subjective and it can be experienced in different ways, some more severe in others. So, this is a question for you. I would like you to rate your pain, so however bad you think it is, on a scale of 0 being no pain and 10 being the absolute worst pain imaginable. Can you please rate your pain right now, at this very moment, in your own words? Okay, I see. And is that a constant pain, or is it intermittent? It's on and off. Understood. Yeah, no, I understand, yeah. So, right. And what is the worst pain? That is the worst pain on that 0 to 10 scale. How high up on that scale does it get? Okay, yep. And is that something that settles down quite quickly, or does it stay at that severe level of pain and then go away pretty quickly? Okay, I understand. Alright, you're doing very well at the moment. Still have a few more questions before we do a few physical or hands-on tests. I would like to know if you've noticed anything that makes your pain worse or aggravates your symptoms. Does that make sense? So, for example, in your case, it might be maybe bending forward or lifting something or reaching out of your base of support. Do any of those ring a bell? Or do you know of any movements or activities that flare up and aggravate your symptoms? Okay. I see, yeah, so the bending forward, yeah. Anything else? Okay. I see. And then on the other end of the spectrum, do you know of anything that helps or eases or relieves your pain by any chance? Okay, yeah, so I'll just write that down. That's a good sign. So heat generally helps, like a hot shower or a bath or a hot pack or having heat cream in the area, that helps. Okay. And have you tried any pain relieving analgesics or medication? I see, so a little bit of relief, yeah. So. Okay. Yeah. Right. I understand. And as this is a back injury, I do want to ask just a few questions to make sure that there are no major alarm bells or red flags to ensure that you are safe and nothing requires a serious checkup or trip to the emergency department to be investigated further. So, are you experiencing any bladder and bowel changes? So, trouble going to the bathroom, essentially. Yeah. Or loss of control of the bowel, for instance. Yeah, I know it's a bit of a personal question, but it is very important to make sure there are no red flags so that we can provide the best possible care to you. Yes, that's right. So, none of those, that's good. How about any pins and needles or numbness in the, what we call the saddle region, or the area of your body that would come into contact with a saddle or a chair if you were to sit down? Are you getting any numbness or pins and needles in that area by any chance? Okay. Understood. Yep. Okay, that's good. Right. Well, doesn't seem to be any red flags there, which is good. Very rarely, very, very rarely do we see any red flags, but it is always good to be safe rather than sorry. I hope you can understand. Well, let's continue. We'll now be just doing a check for some physical checks. So we call this an objective assessment. Objective meaning it is something we can measure and reassess at a later date versus a subjective assessment, which are things that you are telling me, things that you say. Yeah, that's the difference. But we as physios play a bit of a detective role. We don't just, the bodies are all different, everyone is different, so one thing that might work for another person might not work for the person down the road or the next person on the list. So it's important that we have a approach that is all-encompassing. It's not just one fits everyone. Everyone has their own unique mechanisms of injury, their own aggravations, their own activity that they need to get back to. So we try to be specific to you. That is why I need to find out all of this information instead of going straight in and gung-ho. Exactly. Yeah, trying to be as thorough as possible. No stone unturned. So let's get into that objective measure. As I'm going to be placing my hands on certain parts of your body, I will just apply some sanitizer, so just to reduce the risk of infection. And if you just like to stay standing where you are or have a stand up, while I'm at it, everything in the room has been disinfected just before you came in. We have to do this after every patient that we see to ensure our infection control guidelines and policies are met. So don't fret, you're at a very safe environment, and infection control is taking place at this establishment at the Physio Zone. So I just want to start with a few movements of your back. I have with me a measuring tape, and that will aid me in being as precise as possible. So if you could please, now standing up nice and tall, chest out, I would like you with your arms across your chest just to rotate to the side. Just to the side for me. Perfect. I'm just going to be measuring that out for you. Just measuring that one. Hold that position. How does that feel? I see. So just giving that a measure from there. Okay. Just measuring the rotation there. And is that as far as we can go? Okay. And then the other side for me. Rotating with your arms across your chest. Rotating towards the right side now. The right side. Well, my right, your left. Okay, go for it. Alright, just giving that a measure from the top of your shoulder down towards your PSIS, or your posterior superior iliac spine, just one portion of your pelvis. Okay, perfect. Alright, and then that's looking good, all within normal ranges. Does that feel normal though? Doesn't feel too aggravating. Okay, that's good. And then I'll just get you to try leaning forward now, keeping your legs straight. I don't want you to bend your knees or anything. Yeah, just trying to lean forward just in front as best you can. Okay, yeah, that's good. And then coming back up there for me, nice and steady, no rush, slow things down. Perfect. And that felt okay. Okay, so a little bit of discomfort. And is that mainly on the left side of your back, or the right side, or down the middle? Where would you say? Right. Let's see. So favouring that right side, I'll just jot that down. Okay, and now if you could please lean back now as far as you can. Again, I'd like you not to bend your legs. Keep them straight for me. So leaning back now as far as you can while maintaining a straight leg. Yeah, just like that. Perfect. I'll just get you to stand facing the wall there, that side. Yeah, just so I can observe you from side on. Just hold there. Okay, yep. And straightening back up there now. Yep, straightening back up. Okay. Okay, that's pretty good. Pretty good movement there. In fact, you have quite good movement for all of those movements. All things considered, considering your injury to begin with. It's just the lean forward that I'm a little bit, it makes sense with your injury, but we'll just do some more digging. I'm still not 100% certain I know what's going on. I'm not trying to kid you or anything. I'm trying to do as much investigating and detective work as possible so that we know, or as best as we can, that this is the problem or the issue that we want to treat. So that's good. We've looked at those movements. Now I'll just get you to have a seat on the plinth. I'm just going to perform a neural test, or a test for some of your nerves that are in your back. Just seeing if they are sensitive or flared up. Yeah, so let's have a sit on the edge of the bed there. Just on the plinth there is fine. Now, this is a test, like I said, for your neural structures. Sometimes after an injury or bout of pain, we can get some sensitivity in our spine that can cause some extra pain in that area. So I just want to see how sensitive we are, and if we're thinking of any neural structures or neural sensitivity that might be involved in your injury. So as you're sitting there, we're going to perform a slump test. Why is it called the slump test, you may ask? Because we are slumping forward, almost like you're leaning forward, tucking your gut in, and I want you to bring your chin, that's it, your chin just down towards the ground, chin towards your chest, chin towards your chest. So holding that position, I'm just going to apply some pressure, making sure that you maintain that tension in that area. That's good. Yep, good. Now, hunching forward, lurching forward, slumping forward. I'll just get you to try with your right leg, just straighten that one out for me. Yeah, almost as if you're tensing the tops of your thigh. That's good, okay. Just measuring or observing. Now, do we feel any symptoms in our back when we do that? Okay, that's good. We might just feel a bit of tightness in our hamstrings or the back of our knee. That's all you're feeling? Yeah. Okay. Well, that is fine. That's perfect. That's a normal response. Let's try now on your left leg. So the same thing. I'll get you to try and lean forward, arms across your chest with your chin towards your chest for me, looking down. Exactly. Now I'll just get you to try and straighten your left leg. I'll just hold some tension there. Make sure that you are holding that position firmly. Okay. Now go ahead and straighten that other leg. Okay, that's good. Now relaxing there and slowly coming back up, not too quick, slowing it down. Okay. Right. How did that feel, straightening that left side? Was that sore or aggravating in any way, shape or form? I see. Okay. I'll just document that one down. We've done a few tests. Why don't you just go ahead and have a seat and rest while I write these down. So that's good. Right. Well, I think what we're dealing with here is just a bit of a simple one, which is good. A bit of a strained muscle just on the side of your spine there. We've got a few postural muscles that sit there to keep ourselves upright. And sometimes when you're doing a bit of heavy activity, which it sounds like you may have been doing, you can sometimes overload and cause a bit of a strain in some of those muscles, or in this case one muscle in particular. So I'll just have a feel and go over that area with my thumbs and fingers. We might even just give that one a bit of a massage too, just to help stimulate the blood flow and circulation, and also to help with the pain. So I'll just have if you have a lie down on your stomach, yep, just on your stomach, is that position okay for you? Yeah, you don't get any like gastric reflux or... Right. Perfect, so have a lie down. I'll just apply one of these little sheets over your little head's piece there so you can breathe. Yeah, and just have a lie down. I'll just sanitize my hands while you're getting into position, and then we'll give you a massage in through that lower back area. Okay, just having a feel. Yeah, right, so we are, that spot there is quite tender. Okay, right, I understand. Then let's have a feel. Just in through there. Okay, yeah, that spot's quite tight, quite tender and quite tight there. Let's just spend a little bit massaging that one, doing some petrissage. That's it. Just kneading that area. If you've got like a tennis ball or something at home, you can just apply that onto that back region. Almost like you're up against the wall with the tennis ball, putting pressure in there. Yeah. Just to provide a bit of trigger point release there. That's good. Okay. Just a quick massage in there. I might even recommend or refer you to our remedial massage therapist, just to get a nice loosen up through those muscles, because they are quite tender and taut. So just a quick loosen up in through there. That spot there is looking pretty good actually. Just take it easy. Is that pressure okay? Okay. Right. So that's good. The other thing we'll apply is just a bit of tape. I'll let you sit up there now, just on the edge of the bedside. And while you're doing that, I've just got a bit of tape here. This is called Kinesiology tape. This stuff here. And we're just going to apply it on either side of your spine. So Kinesiology tape will just provide a bit of extra support in through those muscles, just so it feels a bit more comfortable. So I'll just get that one prepared. A little bit of arts and crafts while I do this. And yeah, if you could just sit where you are there, I'll just get this one sorted. Yeah, that should do there, just that much. And then I'll just snip a little bit of that off. Okay, just a little bit more. Perfect. Right. Right. Now just sitting up nice and tall there. I'll just give this one a rip. Okay. Okay. Just sitting. Yep, sitting up nice and tall. I'll just get you to lean forward slightly. Just almost like you're, imagine you're leaning forward, hands on lap. Yeah, hands on your knees. Yeah. Yeah. That's good. I'll just get this, apply that tape in through there. And the other side. That's it. We're not putting too much tension through this one. Just to help out and provide a bit of support. Okay. And that one there. I'll just throw the excess away. Right, now you can come back up there. Yep. Right. Does that feel okay with the tape on? Do you know if you're allergic to like band-aids, or perhaps you've had some tape on before in the past? Okay, and that doesn't really hurt, does it? Perfect. Okay. Well, I'll just go ahead and write all that stuff down. Just some general exercises I would recommend you to do. Just doing some knee rocks side to side, where you're lying on your back with your knees bent, so that they're sitting like that. Your knees bent, both of them. I'll get you to start to rock them side to side, just as far as you can, as far as you feel comfortable. So we're trying to find the sweet spot here. I don't want you to push it too far and overload yourself. So that's it. And we'll just stick to about 3 sets of 10 will just be our general starting point. If you feel like that's a bit too much, that's fine, don't fret. We'll just dial that back down and you can do less than that. The key thing here is I want you to start moving. I don't want you to seize up and stiffen up. Movement is medicine in our case. Now, this is something that will get better. It will improve, not overnight, but relatively quickly. I think based on what I've seen in the past and how you're presenting, I think in the next week or two you'll be feeling close to or back to 100%. So that's a bit of reassuring news. However, just use those sets and reps as a guide. But the other thing I would get you to try as well are just some of those general side to side, forward, backwards movements that I ask you to perform at the start of the objective examination. Those will be good just to get your lower back used to movement and used to that load bearing and weight bearing again. Like I said, a bit of movement is okay here as long as it's tolerable. Yeah, I don't want you to go out here and start really hurting yourself doing too much activity. So I hope you can take some time off work potentially. If not, really try and take it easy as best you can within your limits and your tolerable ranges. Otherwise, I might have to write up a referral to your doctor so you can get a medical certificate for work. I'll write that in my notes actually, just so I do not forget. But in any case, I hope I've answered every question today. Did you have any questions in particular that you'd like to know, or does everything kind of make sense so far? Yeah, okay. Yeah, good question. So with the tape on your back, the tape that's on your back, I'll get you to keep that on for a maximum of 4 to 5 days. If you notice that you start to get a little bit itchy or the skin starts to feel a bit funny or in that region, please don't hesitate to take it off immediately. They are waterproof. they are waterproof, so they should stay on in the shower. But yeah, again, 4 to 5 days. And one more thing with your exercises, I'll get you to try perform them daily. And I think it would be a good idea to have a follow-up appointment with myself or one of the other physios if I'm not available, just to make sure that this is what I think it is in the muscle strain. As I said before, we are doing detective work here. If it looks like a duck and quacks like a duck, it's probably a duck. But there are always, you don't want to write anything off. So just more of a checkup. We can give you a bit more of a massage, do a few other treatment techniques to help with your pain. And if you are having any issues, we can address them in that follow-up session. I'd hate to see you get out of here and see no improvement and wonder why you're not improving. I don't know. I think it would be really good to have that follow-up appointment just in case, and also to progress your exercises so they are at a more graded progression. Hopefully that makes sense. I've got to duck out now. Actually, I've got to do some paperwork. A couple of reports, fun stuff. But I'll let you duck out. Head to the front desk and reception, and they'll sort you out with another appointment. Like I said, if you can't see me, then feel free to see any of the other physiotherapists or physical therapists that are available. I can vouch for them. They are top notch. So, like I said, I've got to go. But if you enjoyed this video, please, I'd appreciate it if you left a like. Leave your comments and thoughts down below if you have any. And please click the subscribe button for more content like this one. Take care, and I'll see you all in the next video. And now a shout out to my awesome patrons: Stephen J, Abby Lynn, James Peacock, Electra, Amado L, David LaPizza, Beth Burton, Joaquin, Woyla, Andres, Troy, Gabriel, Patrick, Michaela Rajanen, Megan, Kylie Denton, Josh Santana, Kiera. Thank you.